As per one of the largest analyses of post-COVID health effects to date, it appears that the coronavirus can leave patients at risk for heart problems for at least 1 year following the infection. In a published study of Nature Medicine, it says that the illness increased the possibility of heart rhythm irregularities, as well as potentially deadly blood clots in the legs and lungs in the year after an acute infection. COVID also increased the risk for heart failure by 72%, heart attack by 63%, and stroke by 52%, even among those originally illnesses were mild. The study's lead author, Dr. Syed Al-Ali, a clinical epidemiologist at Washington University in St. Louis, and his colleagues were expecting to see some elevation in heart problems following COVID, but assumed it would be limited largely to people whose health wasn't robust previously. He acknowledged that the elevated risk remained when researchers accounted for age and race, including younger adults, older adults, black people, white people, people with obesity, and those without, proving that the risk was everywhere. The team examined the rates of new heart problems among 153,760 COVID patients for up to a year following their illness. The participants were patients who sought care within the Department of Veterans Affairs, and most were white men. Cardiovascular outcomes were compared to two control groups, 5.6 million people without COVID and another 5.9 million patients whose data was collected before the pandemic began. It is still unclear how the shots might alter the findings because COVID-19 patients in their study were infected before vaccines were available. Even a study in Germany about recovered COVID patients found that 78% of patients had heart abnormalities. Swedish research also found an increased risk of heart attack and stroke following COVID-19. Currently, it is known that the virus can affect blood vessels all over the body and in multiple organs, including the heart. However, it is not entirely clear how COVID could cause heart problems over the long term. I am Lovely Montoya of Manila STV.